Hello, everyone. This is Cindy Rubin. I am a pediatrician and breastfeeding medicine specialist in the Chicagoland area. And this is Keeping in Touch, a weekly show with a potpourri of people who work in the perinatal space. And this week we have Hillary Pilotto, who is a licensed clinical professional counselor who is specialized in EMDR. And she is joining us to chat a little bit about what she does and how she can help people in the perinatal space. So welcome, Hillary.
Thank you. I'm excited to be with you.
So happy to have you. So, to start, what's your story that led you to doing what you do? But
Mhm.
also tell us what you do
Yeah,
so we can know more about that
sure.
first and then kind of what led you that way.
Yeah. So, like you said, I'm a licensed clinical professional counselor. So, I have an online practice out of my home. I see clients virtually, and I've had a private practice since about 2015, but I've been a therapist for like 16 years. So, I work with now adult women who are trying to break the cycle, the generational cycle of anxiety, stress, and burnout. A lot of these women are professionals, they have a working career identity, and a lot of them are mothers, and they're trying to kind of break this cycle of their own upbringing, to parent differently, to connect with their partners differently, to just have different relationships and to be connected with themselves in a different way. So that's who I see now. And like that client has had a different iteration throughout my practice, and it's looked different as I've grown as a therapist and I've changed as a therapist. And so when I first started my private practice, I saw adolescents actually, because
Hmm.
when I got out of my master's degree, I worked in community mental health and in nonprofit. I was in a substance abuse agency and seeing teens who were in prison. And I did that for a few years. And then I worked with community mental health, working with families and teens. And then had my first child in 2013 and took a year and some change off to kind of figure out what I wanted to do, and opened up my private practice in 2015, and kept it really small, did a couple days a week, and still stuck with the adolescents because that's what I knew. That's what I loved working
Yeah.
with. I had never sat across from an adult before
Oh,
in
wow.
therapy. Yeah. So I remember when I did that for the first time, it was very different. But as I had my second child, I had struggles with postpartum, but not right away. Like it didn't hit me. It hits different for every woman, I feel like.
Absolutely.
And for me, it was more in the 8 to 10 month mark where I started to really have some anxiety, and I was going back to work in a different way. I was keeping my practice, but then I started to work for an integrative practice inside of an OB's office. So it was me and another therapist, and we worked together and saw patients in the office. So we were seeing a lot of patients who were pregnant, who were experiencing postpartum struggles with infertility, loss. And I went that route because of my own struggles with like that postpartum. It was just very different when I had my first child.
Yeah.
And so I went through the Postpartum Support International training and got trained through them to work in the reproductive and maternal mental health arena, and did the work in the OB's office. My niche changed in my own private practice. I started to see more women and moms, and left the OB's office about a year later as my practice got busier. And I still really love working with women who have a new baby or who are pregnant, or I work with now through the trauma lens of like, I do a lot of work with birth trauma, women who've
Mhm.
experienced that. So that's who I see now. And definitely some of the moms that I work with, they have older kids now because I
Mhm.
have older kids. So that has kind of just grown. My niche has changed as I've
Yeah.
changed,
Yeah.
for sure.
That's great. Actually, it's interesting that you mention birth trauma. One of my colleagues who is also doing fourth trimester care, her name is Sonal Patel. I just saw a little clip that she put out on social media today, and she said, we think of birth trauma as this big event, like I intended to have a natural birth and I ended up with a C-section. But it's not that. It can be that,
Yeah, definitely.
but it's essentially having a birth and within that process feeling not heard and not respected. It
Yeah.
was a really interesting way of looking at it. I was in a room full of breastfeeding medicine people, and somebody said, how many people here feel like they experienced some sort of birth trauma? And every single person raised their hands.
Yeah. Wow.
It's so widespread because you're in this intense personal medical situation, but just life event. You're
Right.
not sick. And so you want to have some amount of control. And unfortunately, that's not always possible. And it's not always offered, even when it is possible.
Yeah, I agree with that. And it's such a shift, I think, from what people think birth trauma looks like. If you were to ask, anybody, what do you think a traumatic birth would look like, right? It's usually not actually what a traumatic birth could look like. I took a training. There was like a level 1 and level 2 birth, working with birth trauma training that I took a few years back. And one of the things that she had mentioned was a statistic that I don't know the number off the top of my head, but it was, thinking that a cesarean would lead to more birth trauma, but it's actually a vaginal birth leads to a higher instance of having a traumatic birth. And it's because of what you just said, which is like there's this subjective level of support. And, only the mother, it's subjective to her. And that's it. And, the team could look at it and say, like, this was a success. Even, husband or partner could look at it like this is a success. But it's what does the mother think about the event?
Right. It's really interesting too, what you were saying about how your niche has changed, because I wonder how often you actually uncover birth trauma when that's not even what you're you are working on kind of breaking the cycle of past relationships to change yourself going forward. But I know that there are things from birth that sometimes also affect how you parent and how you see your relationship with your baby.
For sure. Yeah. I mean, and depending on what happens like in the room, right? Or after the birth, if there's a crisis or something happens, like where like mom and baby have to be separated, it's amazing that like, mom's healthy, baby's healthy, but there is some type of breach that happens there in the beginning that mom might feel. And it could definitely lead to the experience of feeling a certain type of way about your birth and having that kind of translate into how you mother and parent.
Yeah. Wow. So tell me a little bit about EMDR and what that is and how it fits into your practice.
Yeah, sure. So EMDR therapy is a 8-phase model, basically, and it starts from assessment and you kind of work your way through those phases with clients. And there is a specific protocol used, but I feel like as you do it, you have some finesse and there's some like creative license to kind of like work with your clients in a certain way. So I think each clinician kind of does it differently. But basically what it is it helps process or reprocess, I should say, traumatic memory. And this could be something that's bothering the client present day. It could be something that happened a long time ago. But a lot of times, things that are affecting clients in the now, it's because it's unhealed from the past. So it's just kind of showing up now. I use the analogy with clients when I'm explaining kind of what's happening and why this happens is because our brain's job is to file things in the right places, right? Like memories, they're chock full of images and thoughts and beliefs and body sensations and emotions. And when things are relatively calm, your brain is pretty good at doing that. But once you enter into stress, right, or that kind of like fight, flight, freeze starts to happen, and there's a perceived threat, your brain kind of focuses on, let's just keep this person safe and let's just keep this person alive, and we're just gonna, it's kind of like when the company comes over, right? You just start throwing stuff in the closet. You don't know if it goes there, but you're gonna throw it there. That's kind of what your brain does in those moments. And so when things have finally calmed down, and that could take years, to get to a place where you're actually ready to start, to open that door and be like, let's start, like, you got to pull it all out and you got to like reorganize it. And so EMDR therapy is really helpful in that way of helping you kind of internally reorganizing those images and thoughts and those events. One part of EMDR therapy, the second phase of it, which is resource development. It's just basically tapping into either external or internal resources that we have that maybe haven't been uncovered or looked at in a long time to help us through this difficult reprocessing that could occur with reprocessing some of these memories. And your clients are walking through this with a supportive person, like they're not alone, which a lot of times when clients have gone through something disturbing or traumatic, they have done it kind of on their own, or at least they have felt alone during it. So that is one thing that's different about EMDR therapy is, yes, we're kind of walking through that again, but they're doing it with support, with tons of resources that we've already installed and built into them. So it's just a really nice way to get them prepared for that work. And sometimes, honestly, that's all my clients need. Sometimes we don't even get to the reprocessing of the difficult memories because they just doing that resource development, doing some of that work in that phase too, like feels really good. And they're like, I'm good. And sometimes we do get to the reprocessing. It just depends on what the client needs. And that's what's important to me. Is like, it's different for each client. And I want to make sure I'm partnering with them and not making any symptoms that they have worse, because that's not what they're there for. They're there to feel better.
Yeah. Yeah. I feel like I saw on your website is tapping part of this, like one of the resources. I just learned about tapping and I thought it was absolutely fascinating. Can you talk a little bit about that?
So there is kind of this new wave of this tapping that's happening. Yeah, it's cool, right? One of the things that EMDR therapy does to help reprocess memories or actually install those resources that I was talking about is what's called dual attention. So when your mind is doing two things at once, right? Like you're maybe thinking about this resource that you want to install, or you're thinking about a time like where you felt very confident and powerful and you have your attention on something else. So whether it be like we do tapping or eye movement, which is what actually EMDR stands for, it's eye movement desensitization and reprocessing. So it started with eye movement, but we've found that any type of dual attention, tapping, for kids, they throw a ball back and forth. You can use it, auditory. So, there's lots of stuff that you can do. And that kind of bodes to what I was talking about with that like creative license to kind of figure out what works for the client. So in EMDR therapy, it goes beyond tapping, but it is that dual attention that is important in EMDR to kind of reprocess those memories.
Okay. And is it kind of like a distraction technique?
It's kind of when your brain is doing two things at once, it kind of taps into that place where the trauma hangs out. There's no amount of talking that will pull that trauma up from the midbrain to the prefrontal cortex to process it. So when you have the dual attention, it helps you access that part and access that. So I wouldn't say it's normally a distraction, but it's a tool to help access and reprocess that traumatic memory or install that resource.
Wow. It's amazing to me how many different types of therapy there are out there.
Yeah.
How does a person figure out what will work for them? Like if you've never had therapy before, how do you even get started?
Yeah. Well, of course, every therapist that does a certain type of therapy is gonna champion that therapy
Sure.
and love that therapy. But yeah, I mean, I think different people and different temperaments and personality styles, try different things, right? And different things work for them. Like EMDR therapy is not for every person. And that's part of my job as a therapist, is to be able to know who of my clients that's going to be a fit for. And it doesn't necessarily mean that we can't do EMDR therapy, because like I said, it's 8 phases. There's a lot we can do in that. We just might not be reprocessing. But
Mhm.
yeah, I think as therapists, it's our job to know what's going to work for the clients that we see. That's not necessarily the client's job to figure that out. I know a lot of my clients love to Google and they love to research and they love to become their own experts on different topics. But ultimately, it's our job as the clinician to know, hey, this isn't going to be a fit for you. We can find a workaround to make this model work for you, or you would be so much better off working with a therapist through the exposure response therapy if you have OCD, or if someone is looking for more of a solutions focused type of therapist. So I think it's on us. It's
Yeah.
not necessarily on the client to have to do that work. And I think they just want to feel better. So I think
Yeah.
whatever therapy is going to help them feel better is the one that they need to do.
Yeah. So it's okay to try different things.
I
And yeah.
100%. Yeah. And I really think the relationship between the therapist and the client is so important. And I think that's a huge part of what helps heal clients, is that relationship together.
Yeah.
And so I think, yes, clients, they should have permission to talk to different therapists when they're looking for a therapist and just see what's out there. I think that's important.
Yeah. I know you aren't working with kids anymore, but I think about it in terms of my patients who are kids, and the parent and the child need to both feel comfortable with that
Oh, yeah,
therapist.
for sure.
And that just adds that little bit of
Mhm.
trickiness sometimes.
Yeah, I mean, I think that that's important because,
Mhm.
depending on the age of the child, right? The parent
Yeah,
is the mouthpiece in a sense, right? Is the
right,
advocate for the
right,
child and is the one that's in the home, and the therapist only sees the child like once a week. But the parents, they live with the child. So it is
right.
important to get them involved. It is important that the parents are involved in that child's treatment for sure.
Mhm. I'm curious, so with COVID and all of the restrictions with COVID, I think it opened up a lot of opportunities, especially for therapists, where a virtual therapy relationship lends itself to this so nicely. And I assume that was part of your process.
Yeah, I had an office in Oak Park when COVID happened, and I was actually in the process of looking for a bigger office. And because I had a clinician that worked for me, and I was kind of in the thought of like I was going to grow into a larger group practice.
Yeah.
I said that I had a baby group practice at the time. It was just me and the other therapist. Then I had an admin who was remote, and we were working really well together. And then yeah, COVID happened, and we were busy. There was a
Yeah.
slight moment when I was like, are we going to come back from this? Like, is
Yeah.
anyone going to want to do this? Is anyone going to want to see people online? I mean, we were so busy and just trying to give people the help that they really, really needed at that time. And like you
Mhm.
said, therapy was more accessible because it was online and it was more convenient and everyone was home. And we did not have a lack of stressors, like we had way more. And that kind of ebbed and flowed with COVID and politics and all that stuff. So I didn't see clients back in my office again until 18 months, which I never
Yeah.
thought would
Wow.
be the case. And I love doing online therapy now. And even, doing EMDR therapy online, people are like, can you do that online? And we didn't have a choice back then. And we took courses on it, trainings, and we figured out how to do it. People
Yeah.
had been doing it for years and years and years, but now it's just kind of second nature. We do
Yeah.
it. And now I think it would be weird to sit in front of a person in person again. I'm like, I could see myself going back in person at some point. I'm liking the virtual now with having younger kids. It's just much more flexible. But I was just thinking about that the other day. I was like, can I? Well, it would be weird to sit in an office with somebody because some of these clients I have never met in person. The bulk of my caseload I haven't met in person. So it is different.
I remember one person saying to me recently, I've never seen you without your mask on. I didn't really know what you looked like.
Yes, that happened at one of my kids' school. Mom, I like said their name and then I said their name again. She was like, yeah, it's me. I was like, oh, okay. Yes, that is you. I've only seen this, Yeah.
Yeah. What a interesting social experiment we have lived through.
Yeah. And still living through.
Yeah, for sure.
Yeah.
Well, I know in pediatrics, for the mental health issues in pediatrics really came up when COVID was coming not to an end, it's not over, but when things were opening up and these kids who had been holed up for a year and nobody was aware of all of these things going on with this kid, and then they come in for their 15-minute checkup and
just in the social component and then the school, right? Like going from half day to remote to back to hybrid and that social component where the kids, they just weren't seeing their friends. And I just feel like missing out on socializing normally for elementary school kids and middle school kids. That has an impact. And I think that's what we're seeing right now. They're struggling. And the parents that are just trying so hard to get them the help that they need. And, they're just running into roadblocks, or it's almost like a part-time job. Search out the right therapies and appointments, and people have wait lists. And so I think there's a lot of challenging things that are happening in that world with parents and their kids, for sure.
Yeah. And I think at one point for listeners who maybe are struggling with older kids or even with babies, that keep looking for those supports for your child, but you may need those supports yourself, and that will help you to be a better parent.
Yeah. You can't pour from an empty cup. You have to put your oxygen mask on first. All of those sayings, like, I think they definitely ring true, but as mothers, I just feel like it's so easy for us to put our stuff on the back burner and just white knuckle it, like while we get our kids the support that they need. And I just think it would be so much better if we could do that for us first. But, of course, that brings up like feeling selfish and guilty and I should be worrying about them. This is something that I work on with my clients all the time, that it's a great thing that they're in therapy and they're working on themselves, but that guilt component of taking care of themselves, while taking care of their kids.
Yep. It's hard. I'm glad to know I'm not the only one with the noisy puppy in the background. Don't worry about it.
FedEx guy is here.
Yes, of course.
Camped out outside.
Well, this has been so interesting, and I could probably talk for another hour about it, but I am going to ask you a couple of questions that I ask everyone. So not really related to what we've talked about, but number one is, what is your favorite thing about living in Chicago, Chicagoland, either a favorite restaurant or a favorite thing to do or something that you love?
I think overall, like, one of my favorite things is just, there's just always so much to do. You can't really get bored. Whether if you want to try a new restaurant, it's out there. If you want to see a show, it's out there. Visit a museum, it's out there. Go be in nature, whether it be like beach, forest, it's out there. So that's probably my favorite thing, that there's always something to do. And I think summer in Chicago is just the best time, and you can't go wrong. There's lots that I love about it. And I've lived here all my life, and there's still things that are on my bucket list to do. So I think that's pretty cool of a city to live in.
Yeah, no, it is. It has everything. Like, it has sports and restaurants and the beach and music and it's just everything. Yeah, it's very cool. All right. And now number 2 is if you had a chance to go back and talk to your 20-year-old self, what would you tell her?
I would tell her just the best is yet to come. Like
Mm.
things are about to get really good and fun and tough, and just listening to herself more. You
Yeah.
know, that there's kind of a knowing voice in there and like, kind of a nagging feeling that comes up from time to time that should be listened to and not to cut that off, but to connect with it. And it kind of will lead you in the right direction.
I like that. I'm reading a book and they were talking about something similar, which is that you have to focus on what you want, not what
Mhm.
other people think you should be doing, but what you want. And
Yeah.
there's a certain flow to that as things go on, as it's not always going to be a straight and narrow path.
No.
Um,
And I think that age in particular, 20, such an interesting age because they're kids still. In my mind, you're a kid and
right.
20, and you're still like, there's kind of this looking to your parents for guidance, but then
Yep.
the expectation that you should be listening to yourself. And yeah, it's a very formative age. And that's what I would say is listening to yourself more. And if you really find you don't know what the answer is or you're not sure, then those supports are there for
Yeah.
you. But it's important to connect with yourself.
Yeah. I think that's really good advice.
You.
Well, so if any of our viewers are feeling like you might be a good fit for them professionally, how can someone reach you?
Yeah. So probably the easiest place is my website, betterbalancecounseling.com. And I have just all kinds of info about me and what I do and who I see, and a way to schedule a consultation if somebody is feeling like we would be a good fit. I offer a 20 to 30-minute free consultation with new clients, and it's done over video to see like, do we kind of vibe together?
Yeah.
And I'll ask questions. They usually ask some questions about me. So it's just a really good time to see, is this a good fit? Would this be a good fit working together? So I always do that. And if I find that for whatever reason we wouldn't be a fit, I always will send out referrals to people that I know and trust, and they would be in good hands. So that's the
Great.
best way to contact me, my
All
website.
right. Great.
Yeah.
Well, thank you so much for coming on Keeping in Touch this week. It has
Sure.
been enlightening. And I'm so glad that we have been able to connect. I hope that that relationship will continue
Me
as
too.
well. So, everyone, have a great weekend and join us next week for our next episode of Keeping in Touch. Thanks,
Bye.
Hillary.